Okay, welcome back. Time now, 8:24. Think about what you do with your arms and your hands every single day. Small motions that you repeat over and over with little to no thought. The frequency of these movements can actually put you at risk for repetitive strain injury. Here to discuss further and give some tips on avoiding this is Dr. Misty Suri, sports medicine orthopedic surgeon at Ochsner's Hospital for Sports Medicine. Hi, thank you for being here.
Good morning to you. Thanks for having me.
That was certainly a mouthful, but you know, I know a lot of times like you do these repetitive motions and you may feel a little strain or so. How do you know if you have repetitive strain injury?
So repetitive strain injury, Gina, it's kind of like this. So I assume you've never chopped wood before.
I haven't.
Okay. so I chopped wood over Thanksgiving with my wife, and I've never done that before. So what happens when you do something like that you've never done before is you have these micro little strains and tears in your muscles and tendons. And if we do that over time, over and over again, without the body healing it, having a chance to heal it, then that's what can cause an overuse injury or a repetitive strain injury.
I see. And so what do you recommend? Or is it people normally think that they may have something else? I know my husband's always like, is this carpal tunnel? Like he'll feel something, he's like, is this carpal tunnel? So how do you know?
So you got to correlate it with your activity. So say you're at work all day and you're lifting boxes over your head and your shoulder starts hurting. Okay, well then maybe you should try to vary the exercise, how you're doing it, give it to your left arm, do the right arm if you're right-handed. So you need to know if it correlates to activity, if it goes away with rest, if it goes away with some anti-inflammatories. So you have to try to, or if you're weak. Now, if you're weak and you can't lift anymore, for example, if that was your job, then okay, maybe something's torn and maybe you need to get it evaluated.
What are some of the strategies to actually avoid overuse injuries for an athlete or, you know, just a regular person?
Sure. So if you and I are working at our computer and we're right-handed, and if our right wrist, for example, or our right shoulder is starting to bother us, then maybe we should use our left hand. Try to distribute things to your other hand. Try to obviously give it rest. If you're training for something and you're training every day, all day, for weeks at a time, okay, maybe you should rest for a day or two a week. If you're a young person and you're growing, you can have problems in your bones and your ligaments also because they're a little bit weaker than as we get older. So maybe you should try to not play that sport or throw, for example, every day for months and months at a time.
And so that's basically how you would treat the repetitive strain injury, just to rest or try and distribute activity?
Also, you can do proper stretching and also the right exercises to help prevent that area in your body from getting overloaded, so that way you can distribute the area of force to different parts of the body, different parts. So you have to have the right mechanics. For example, in your shoulder, you have to have the right mechanics. So if a certain part of your shoulder is getting overloaded because the rest of it's weak, then maybe you have to get the rest of it stronger so that one area doesn't get overloaded.
And that's my final question for you. If you do experience something like this, oftentimes like your body can compensate for experiencing a weakness or whatever. Does that precipitate, I guess, more injury, or could that cause further damage?
Absolutely, it definitely can. For example, in a young thrower who's maybe a baseball player who's 14 or so, if he's throwing with improper mechanics over and over again, he can break something in the bone, he can cause rotator cuff problems, he can have elbow problems. So we have to try to keep everything with the right mechanics to hopefully not overload the area in one specific spot.
All right, all good information. Thank you for your time this morning. More information on repetitive strain injury, you can visit the website on your screen. That's ochsner.org.